the skin, I always kind of compare it to a cake, for a better term. So basically the frosting of the cake is our epidermis, which is the finest layer of the skin. That's essentially what creates our skin barrier. Underneath it, kind of like that fluffy portion of the cake, is our dermis, where nerves and blood vessels and collagen and elastic fibers are, and that's what makes our skin be able to be squishy. And then underneath, kind of at that plate or the base of the cake, that's where our fat is, and underneath is the muscle. So really that epidermis, that frosting of the cake, is really what we determine as skin barrier, and it has different components that will allow us to both interact with the outside, but also protect us from the inside and protect us from bacteria, viruses, fungus, and different sorts of infections. If we think again about this skin barrier, the outermost layer, thin layer of the skin, primarily is called the stratum corneum, is basically crucial in keeping our skin moist and also being protected from irritants or allergens or different pathogens like we talked about. So ideally, a skin barrier that is healthy should help prevent water loss, meaning that it keeps your skin moist, it's not like overly dry, should help block harmful substances from going inside, like bacteria, viruses, pollutants, chemicals, and should also regulate the skin pH and microbiome that will basically help support this healthy skin environment. There's some environmental factors that can damage the skin and some intrinsic factors of our skin. So for example, if you have eczema, we know that eczema is a problem where there's a protein that is not working very well, and it's allowing your skin to get more irritated, more itchy, scaly, and it allows more water loss than normal. But for example, if you have a skin barrier that is healthy, that shouldn't happen. The first thing that you need to know is to recognize if your skin barrier is damaged. And that's if you have dryness or flakiness, if you have redness or inflammation, if you have increased sensitivity or burning or stinging sensation on the skin, or you have multiple breakouts, like say with acne or different rashes. Those are signs that your skin barrier is probably damaged. How to protect it? This is where we would definitely want to stay away from what you hear on social media. I always tell families and parents, if there's something that is supposed to be in the kitchen, it shouldn't be on your face. So that's my first rule. So don't put anything that you would eat on your face. And then basically just using gentle fragrance-free cleansers can help protect and repair your skin barrier. Moisturizing is really key because that will help prevent that excess water loss that can lead to dryness, irritation, sometimes eczema outbreaks, like I mentioned before. So looking for products that contain ceramides, niacinamide, or hyaluronic acid that can help repair and protect the barrier. Also avoiding over-exfoliating or harsh skin care products. Nowadays, we have a ton of material, as you mentioned, on social media about this acid and this exfoliator or these serums. And unfortunately, as much as they sound quote unquote wonderful, if you use them without a guide, you may be over-exfoliating your skin or using chemicals or actives that interact with each other, making them even more irritating. So that's something that we should avoid. And then minimizing exposure to extreme weather, extreme hot water, chemicals in the environment, pollution, smoking can also disrupt the barrier as well. So making sure that you're staying away from cigarettes, vaping, and all of that.
One thing that comes up in clinic for me a lot, because I see older patients, is your transepidermal water loss, which is TEWL, transepidermal water loss, goes up every single year from the time you're 18 until the time you're no longer with us. So literally every single day I'm seeing you on the driest day of your life if you're above 18 years old, which you are in our clinic. So it's important to realize that you're losing more and more moisture each year through your skin, just as part of the aging process.
The sometimes, we become overwhelmed because there's a lot of products out there, but there's also a lot of things that shouldn't be combined. But nobody tells you that, and you'll find out as things burn or sting. Other people also think that because, oh, I'm using this product and my skin is burning, that means that the medication's working. No, it's just getting irritated. So I think knowing what you're putting on your skin and how to combine skin products, which obviously we can guide as dermatologists, is going to be the best way to really protect that barrier and repair it without making more harm.